Dr. Salmon, you said vaccine haters are few and that actually 8 of 10 parents are concerned about vaccinating their kids. Please break down what their current concerns usually are.
Yeah, the most recent data I've seen show that 7 or 8 out of 10 parents have concerns. Sometimes it's very minor concerns like concerns about a fever or concerns about mild pain. About a third of parents express concerns about the number of shots given at one time or in the first 2 months of life. And then some parents have concerns about other diseases like autism or ingredients in vaccines. So it's really a broad spectrum of concerns that parents have.
Mm-hmm. Explain the demographics of unvaccinated children versus under-vaccinated children.
Yeah, the difference we see is really between parents that don't get vaccinated for health systems reasons versus parents that choose not to vaccinate. The parents that have problems vaccinating on time for health systems issues are more likely to be minority, lower income, lower education, although a lot of those disparities in immunization coverage have been reduced. Parents who choose not to vaccinate tend to be higher income, better educated, have more children, and that's socioeconomic status.
Describe the types of exemptions for vaccinations and how they vary from state to state.
Sure, all states have medical exemptions, so some children can't be vaccinated for legitimate medical reasons. They have contraindications. Maybe they are going through cancer or cancer treatment, and every state allows those parents to exempt out of the school laws. 48 states offer non-medical exemptions, sometimes called religious or philosophical. What we see is there's a lot of variation in how those exemptions are implemented and enforced, and some states make it very easy to get exemptions, and some states make it much more difficult.
Mm-hmm. And in this current climate, have you seen some states modifying those exemptions for fear that there are too many unvaccinated kids in the population?
We have. We've seen 4 states recently make changes to their law: California, Colorado, Vermont, and Washington. And all 4 of those states had very easy exemptions, had a lot of exemptions compared to other states, and had a lot of pertussis. In an effort to try to reduce the rates of exemptions and control pertussis, they've added requirements such as education and counseling.
And you cautioned reporters to be careful about reporting data from the vaccine adverse event reporting system. Could you describe that for camera?
Sure. So the vaccine adverse event reporting system is run by FDA and CDC, and it's designed to pick up any unsuspecting problems, to be an early warning signal. And anybody can report anything to theirs. If I report, for example, that I got a flu shot and my dog got hit by a car, that report will show up in the VAERS database. So what it's good for is picking up unusual things you didn't expect. What it can't do is tell you whether or not the vaccine caused the adverse event. So you have to be very careful. Just because it's in there doesn't mean that it was caused by the vaccine. And there's other systems in place that can try to answer those questions of causality.
And is there an opportunity arising from this current controversy over vaccines?
Well, I think for one, there's an opportunity for people to become better educated about vaccines, about the benefits of vaccines to their children, to their community, as well as some of the science. For example, the fairly convincing evidence that vaccines do not cause autism has been well described in the media. So I think there are some opportunities.
All right, thank you.
Thank you.